Hi, everyone. Steve Adubato. We kick off the program with a distinguished member of the state legislature, State Assemblywoman Nancy Muñoz is Deputy Minority Leader. That would mean, Assemblywoman, that's the Minority Leader. That's the Republican Party, right?
Correct.
Just checking. Um,
Minority, that's the key there.
exactly. Assemblywoman, you've been with us many times, but in addition to your work as a state legislator, particularly focused on healthcare issues, 35 years as a nurse. Fair? Is that accurate?
Uh, More than that as a nurse, but probably years working as a nurse. Yes, that's accurate. Actually, I graduated a long time ago, but I still have my nursing license.
The most significant challenge facing the nursing profession today is?
Right now, the biggest challenge, I believe, is we have a tremendous shortage of nurses. And having this tremendous shortage of nurses impacts the ability to deliver care because we simply don't have enough nurses. I think COVID had an impact on it. People who were, nearing retirement decided that it was time to retire. People were stressed out because of COVID, and young people aren't entering the profession. The other problem we have, Steve, is that we probably don't have enough slots for a professional nursing education in the state, which is an issue. I've been working for the 14 years I've been in the legislature on how we can help that issue. Do we, the community colleges are in a position to do the preliminary education of the nurses, the pre-science courses, the chemistry, the biologies, the microbiology, et cetera, and then transition into the baccalaureate program. So, we need a very coordinated and smooth transition from one to the other. And I've actually worked with several of the community colleges, i.e. Union County College, to allow them also to grant a Bachelor of Science in nursing. The courses would be the same, the qualifications would be the same, they would take the same test. So I think we need to be more flexible in our thinking on how we educate the nurses. I'm a real strong believer in a Bachelor of Science in nursing should be what everyone should strive for. And I think that we can do it if we work together.
The other issue that I think about, because we've had so many healthcare leaders on talking about this, is the pay for nurses. And that there are many who argue that these traveling nurses who are not staff nurses, they're getting paid so much more moving from hospital to hospital, hospital system to hospital system, on a day rate or based on a day rate that allows them to make more than if you were a staff nurse. So the question becomes, where's the incentive to be a staff nurse?
That's a really good point. Traveling nurse is not for everyone, obviously, because a lot of nurses, have families and they need to be able to, live near their family. And the traveling nurse program actually lets you move around the state also. And the traveling nurse program was set up initially so that we could fill in those slots where we had shortages. And then when they can overcompensate, meaning they pay much more, and I think we have to factor in, and I don't know the answer to this, all the benefits that nurses get who work within the hospital system. So, you have to add another 30% on, 33% on to your pay when you talk about benefits such as healthcare and vacation time, et cetera, et cetera. So we have to look at that. I've been a strong proponent that hospitals should offer continuing education for nurses who want to get their bachelor's degrees, loan forgiveness programs for nurses who will come to work for them, especially in those hospitals that are most in need, underserved areas such as, our urban areas where we need more nurses. Loan forgiveness programs, we do it in other professions. We do it in medicine. We do it in psychiatry. We should be doing it in nursing as well. If you commit to 5 years in a underserved area, we'll take off, whether it's whatever the X number is per year off your student loans. That would incentivize nurses to come and stay.
Real quick follow-up on this. Burnout. I think a lot about the issue of wellness, and for physicians and nurses. How hard is it to calculate, Assemblywoman, the burnout factor? Burnout is such a ridiculous word. The impact, the psychological, emotional, physical impact of COVID on nurses.
That's a really good question because it really is hard to quantify. And I think for every person is personal. I probably believe that depends on how every institution handled the issue of COVID. I have lots of friends in nursing, and And a lot of places set up teams. And I think that the teams work together. They brought nurses who worked on the floors and brought them to the
That's right.
intensive care units. And they worked in 4-member teams so that they had each other to depend on. I think that people who were broad thinking and could actually look at ways to make sure that those people who don't have a background in intensive care nursing had the backup that they needed. And I think that that's where we need to be as far as like supporting us longtime, the new nurses with backup from longtime nurses to work collaboratively as a team, rather than throwing people into a system that says like, sink or swim. And I really feel like that backup, that teamwork is integral to healthcare delivery, because, the nurses and doctors and all the healthcare professionals work together. We should be looking at that and how we can better facilitate that to prevent that burnout.
Real quick point before I ask you about childcare. Assemblywoman Muñoz volunteered during COVID, jumped in onto the front lines, if you will, to help out. She's not going to say that, but it was needed to be said. Nancy, let me ask you this. Childcare, our initiative, Reimagine Childcare, the graphic goes up right now, talking about the need for more affordable, accessible, quality childcare. How high a priority on your legislative agenda is this issue?
It's an issue I've definitely been working on since for many years now, and I think it is a priority if we want to get people back to work. I put in a piece of legislation with Assemblywoman Pinta Marin, who's from Newark.
The Ironbound, that's right.
It is to have child care available at the State House for those who work. How do we get more women into the legislature? Partly by allowing them to be able to get to work. So, we're looking at all of these things. How do we, if we go back to healthcare, many hospitals figure out ways to provide childcare at the facility if they have the room, which, will bring us to the topic of hospitals having the ability to, or any business, to provide access to childcare. And also, we have to be mindful that most of the childcare providers in this state are small businesses run by women. And we must do everything we can to help these small businesses, both in facilities and in ways that we tax people and ways that we present this. We want to make sure the state doesn't move it away from these small businesses, because this is really a leg up for many people as to start a small business and to succeed and to be part of the solution to this issue.
Next time we have the Assemblywoman with us, we're going to try to, we'll have a comprehensive conversation about the number of women who have left the state legislature and the need to have more women involved in elective office, particularly in the state legislature. Assemblywoman Nancy Muñoz, who is the deputy minority leader, that is the deputy leader of the Republican Party in the state assembly. Thank you so much, Assemblywoman. We appreciate it.
Thank you very much. Thank you.
Stay with us. We'll be right back.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by Holy Name, the Turrell Fund, supporting Reimagine Childcare, New Jersey Sharing Network, Horizon Blue Cross Blue Shield of New Jersey, PSEG Foundation. Operating Engineers, Local 825, New Brunswick Development Corporation, the New Jersey Economic Development Authority, NJM Insurance Group, and by these public-spirited organizations, individuals, and associations committed to informing New Jersey citizens about the important issues facing the Garden State, and by Employers Association of New Jersey. Promotional support provided by NorthJersey.com and Local IQ, and by Insider NJ.
I am alive today thanks to my kidney donor. I am traveling and more active than ever before.
I'm alive today thanks to my heart donor. I'm full of energy and back singing in my church choir.
I'm alive today thanks to my lung donor. I'm breathing easy and I'm enjoying life's precious moments.
There are about 4,000 people in New Jersey waiting for a life-saving transplant.
Donation needs diversity. For more information or to become an organ and tissue donor, visit njsharingnetwork.org.